Hi there, and welcome back. My name is Sheldon McLeod. This is Thinking Out Loud. It's presented to you here by the SaltWire Network, and thank you for being a part of the largest independent digital audience in Atlantic Canada. And this is a real opportunity for me to dig a little bit behind some of the headlines that we've had. Obviously, been covering politics for a long time, and stories come up. I've mentioned a few times in the show, in the space, that committee meetings don't tend to get a lot of attention unless, of course, you have the Deputy Minister of Health who shows up and talks about how, well, essentially, we're very much more aware that more needs to be done to create a healthcare system that Nova Scotians need and deserve. The way we've always done things is not working, and the time for change is now. That was actually a quote from the Deputy Minister of Health, Jeannine Lagasse, and it was about a week and a half ago at Public Accounts. And the reason I'm leaning into this is because the Minister of Health, once elected and once chosen to serve in cabinet, was given a mandate letter from the Premier of this province, and it said, in essence, here's what we want you to do. Here's the task at hand, and a government that was elected to fix healthcare or to offer solutions, as Premier Tim Houston has described it. That's no short order. That's a lot to take on. Michelle Thompson is the Honourable Minister for Health and Wellness in Nova Scotia, and she's joining me now from her constituency office in Antigonish. Minister, it's so nice to see you. Thank you for taking some time today.
Thanks for having me. I'm glad to be here.
And just to look back at that mandate letter, and it was very, some of these targets are very aggressive. 18 months to turn around or at least improve surgical wait times. That's just a few months away from now. Are you confident that you're on pace to meet the requirements that the Premier's laid out for you?
So certainly it is a very ambitious mandate letter, and at times it does feel daunting. I won't say it doesn't, but I also know that I feel very strongly that we are on the right path. I've been in healthcare for a long time, and we've nibbled around the edges. As long as I've been a registered nurse, there has been change, is what I would say. And we know that in order to give the province, Nova Scotians, the healthcare they deserve, we do have to transform healthcare. So yes, there has been some initial work done on the surgical wait time. It's not going to happen overnight, but the changes in the transformation that are happening will lead to a world-class healthcare system, and it will create more timely access to surgical, diagnostic imaging, and other access to care.
Okay, let's just for a second take a snapshot. I think the Deputy Minister was reflecting on and discussing some of the challenges in emergency departments. And you probably know more than I do about exactly the state of what's happening. And people close to me have been getting the flu. People have been sick. People have been taking their children into the IWK specifically, but emergency departments across the province. And if what we have been doing isn't working, how do we address an acute situation such as overcapacity in emergency departments in Nova Scotia right today?
Right today. So we always expect and want and support our care delivery providers with expansion plans. So we know particularly over the last 16 months with COVID in particularly, we know that we need to have periods of time where our services need to expand to meet the demand when we see particularly circulating respiratory illness. So always working in the moment, supporting healthcare workers, supporting Nova Scotians, making sure that acutely we respond to what's in front of us, respond to the demand to the best of our ability. So as an example, standing up very quickly since September, a mobile unit. I don't know if you've heard about the mobile unit. It's traveling throughout Nova Scotia, and that's averaging on weekends around 75 to 100 patients who are being able to be seen there, treated there, and diverted from emergency rooms across the province. So we want to increase our capacity in order to support that as an example. But while we do the immediate, we also have to look at transformation in the long term so that we can create a system where we can offload emergency departments and ensure that Nova Scotians have access to care.
Which is a fair comment. But then I get those notices that say the emergency department at Hants is closed this weekend, or there's several rural hospital ERs that have just not been open. So folks who will say, well, that's fine that you can set up this mobile clinic, but there are communities or areas where they feel underserved now. So I know the door was cracked open to discussing whether or not it was appropriate to have 24/7 emergency room care at every hospital in every community that has one now. Is that still on the agenda? Are you still talking about that?
So there's a couple things there. I think one of the things that I would like to acknowledge is that we know that recruitment and retention of healthcare workers is a primary focus for us. So we know that we have gaps in our workforce, and we're working really diligently in terms to how we address that. So number one, we want to grow our own workforce. And we're doing that through increasing seats in schools. We're looking at, offering every Nova Scotia graduate, nurses particularly, a job over the next 5 years. We're trying to, bring some folks back who may be left for retirement to see if there's ways that they can participate. So workforce is very, very important. And that's going to be a key for our success. We know that things are not always going to look the way they always did. So if we are going to look at a continuum, we have emergency services. We have regional facilities that have different abilities, right, in terms of the infrastructure and workforce that they have. We need a world-class and have wonderfully trained paramedics in this province, and we need urgent treatment centers. So the data that we use to help us inform how people are utilizing and accessing services is really important to help us plan. But we do want people to have the right provider at the right time in the right circumstance. And so that's going to create and require that we have a system that's very agile and that we use all of our healthcare workers to the best and highest use of their scope of practice.
And as someone who worked in the system, I know nurses who say, retention is a huge part of it, but it feels unfair sometimes too. And I know the story was in the media about travel nurses. Some of these nurses are traveling just slightly farther than some of the worst workers who are there now at some of these facilities in rural Nova Scotia. And to know that they're making half as much, that seems like a system that, although I can understand why it was necessary to make that move, it makes it tougher, I would assume, for the retention part. You can imagine working short staff and knowing that somebody's being paid extra to come in to help. So how does the minister respond to that?
Yeah, so travel nursing is essential. To your point, we know that we want to support our folks. We need the staffing to make sure that there are safe staffing levels. And also it speaks to the gap. I've known for at least 15 years as a healthcare worker that eventually we were going to be in this position around workforce. And we're not unlike other places across the country and around the global shortage that we have. And so the goal is really to stabilize and enhance our own workforce. And so we need to we have this urgent moment in time where we need to utilize the resources that we have available to us. And we also need to look at long-term, how are we going to shore up our workforce? I mean, as simple as 30 years ago, there was no work, if you can imagine, for nurses. I couldn't find a job for about 8 years after I graduated. And here we are where we need so many staff. So there's always the acute part. What can we do to make sure that things are safe and reliable? And then how do we address these long-standing chronic issues that have not been tended to in order to stabilize our workforce? And around recruitment and retention, so we know that money, obviously we're getting ready to get into negotiations with a number of our collective bargaining units. And money is absolutely a part of it. But we also want to understand what work-life balance can look like. It's very difficult to work under this amount of pressure for extended periods of time. It takes a toll on healthcare workers. And so what are the other opportunities that we have and that Nova Scotia Health and IWK has as an employer, not only to compensate fairly, but also to look at the work environment and how can we make improvements so that we are supporting our healthcare workers. And I think that's another conversation that's really important for us to have.
I'm not sure how often you're updated. You mentioned the nurses who are being recruited to, student nurses and trying to fill that gap over the next 3 to 5 years. Do you have a sense as to whether or not, that's reaching young high school students and university students who may choose that as a career?
It's difficult to understand who's thinking about, long-term or healthcare and long-term care as a possibility of a place to work. But we do know when we are doing this tour right now, as an example, or when people say, "What can I do to help?" I talk about the opportunities in this province. We want our young people, we want all of our Nova Scotians, but our young people specifically to understand that there is work in almost every single community in our province. And we hear a lot of negative things in the media about healthcare, and I want to acknowledge that the system is very much under strain. I also think it's very important for people to know that healthcare is an incredibly rewarding place to work as well. And being a healthcare provider is very noble and meaningful work. And it has been a wonderful career for me and for many of my friends and colleagues. And so again, we want to acknowledge where we are right now. We want to see the opportunity for all communities in Nova Scotia to keep youth and young people here home working into the future, and encourage people that this is a great profession, and we need their help if it's something that they're considering.
I just got the news release from the government about helping international doctors come to Nova Scotia, something that was just announced this morning. What can you tell me about that plan? How is that? Where do you see the potential in that plan, and how will it work?
So I think there's lots of potential. So there's a few things we heard on the tour. So when we formed government, within 2 weeks, we went out on a tour across the province from Neils Harbor down to Yarmouth and all points in between to hear directly from healthcare workers. And we did hear from people that our registering process was complicated, and it sometimes excluded people. And so we've been working really hard, particularly with the colleges in Nova Scotia, nurses and physicians, to understand where we can streamline those opportunities. So we have folks who were born, raised, and educated in other countries, right, for their medical training. But we also have a pool of people who are Nova Scotians who actually have been internationally educated as well and need residency programs in order to come home. So one, for those physicians that are already qualified and credentialed, we want to make that easier for them. We want to understand how we bring them in, make it easier, shorten the time frame. As an example, we were able to, in some instances, take away the requirement for mid-career exams to be a requirement in order to register in the province. We can offer restricted license that allow people to work in the province. And we can also look at folks who maybe aren't able to fully credential to work in the role of a clinical associate that allows them also to use a number of their skills. We're working with CARMS, which is the Canadian Residency Matching Service, about how we can identify Nova Scotians who have been internationally educated, who want to come home and work in their home community, and how do we identify them and make sure that they get the residency program that they require. We're doing similar things with the College of Nurses as well. And we're also looking at what is the opportunity to have an Atlantic license so that there is some economic mobility within the Atlantic provinces to support physicians who perhaps want to work in a locum capacity to be able to move and experience the provinces maybe before they settle, or just it's a certain type of lifestyle they want. So we're trying to be very accommodating to our healthcare providers to and make sure that they have an opportunity to come and see Nova Scotia, work in our healthcare system, and hopefully lay down roots.
And I did note there seemed to be no comment on that release from the Nova Scotia College of Physicians and Doctors. Are they on board with this plan? That you mentioned jurisdictionally, people might be surprised to know that if you're a doctor licensed in New Brunswick, that you can't just come to Nova Scotia to work. So I'm wondering what they're saying about this plan.
Yes, they've been very supportive. They've been very good partners, both Nova Scotia College of Physicians and Surgeons as well as the Nova Scotia College of Nurses. They've been very good, very engaged. We can't do this work without them, right? So it's very important that we have partnerships and that we work in a collaborative nature. So yes, we've had very good relationship with the registrar and the college, and they're moving these things forward. We know that the colleges have, at the end of the day, their responsibility is safety, to protect the public, and we want to respect and acknowledge that. We're not willing to just take anybody. We want to make sure that those safeguards are in place. However, I do think we're at a time and place where we need to examine our processes and make sure that they are fitting for the place we are today.
Minister Thompson, this tour that you're on currently, you'll be in Digby tonight, as you mentioned. There was some question by the opposition about the process. Are you restricting questions? Are you pre-screening questions? What are you doing to make sure it's an open and honest dialogue from people? I guess I'll put it this way. Everybody who goes to a doctor or a healthcare setting wants them to be optimistic, but they also want them to be pragmatic. They don't want to hear something that's not true. So what are you hearing at these events, and how is it helping shape policy and the direction of your government and your department?
Yeah, so there's a couple things. We do have some capacity issues, of course, depending on the venue that we're in. But no, we're not restricting anybody to come. We do. There are some folks who can register, but they're not willing to attend, and we have their submitted questions. We take questions from the floor. It's very real. There's not a lot of bureaucratic talk at these. We're going out particularly to say this is what we're up to. Not everything is the same, of course, in every community. What works in Metro may not work in other places. And we want to hear from people directly about what some of their concerns are, but also their solutions. Like, it's very important that communities are engaged in healthcare, and there's been folks that have asked really good questions who have made some good suggestions around solutions. And so no, we're not. We've had some tough questions. We've had a couple of tough sessions, so there's certainly no screening involved. And we want people to come and hear A, what we're doing, and B, tell us what they think we should be doing. It's really important. And overall, when we have an opportunity to dialogue in the community, for the most part, we're very aligned. We're talking about access to primary care. We're talking about how are we recruiting and retaining our healthcare professionals. We're talking about the emergency health system, and people want to understand what's happening behind the scenes. So they've been very, very constructive and positive, but they've also been tough, and that's okay. I think people should have access to their elected officials, and we should be accountable to people to answer those tough questions.
Yeah, I don't want to get into the weeds. There's a bunch of information in that mandate letter, the ministerial direction, that it was about governance, but I guess just to kind of bring it all back home, that raising expectations, and I know the Premier said it may take more than one term in order to, quote unquote, offer the solutions to fix healthcare. But when you raise expectations and people say, well, look, the doctor's wait list seems to be longer than it was since this government took over, that there are challenges with so many viruses in student populations and adults, all of this to say, how are you managing the expectations of people who come to you and say, well, you said you were going to fix it, and it doesn't feel like that's happening?
Mm-hmm. So I think it's really important for us to tell folks what's happening behind the scenes. So and I also say, it's going to change incrementally over time. Unfortunately, it's not a one and done. It's not as simple as just saying this is going to do this. But each of these things, each of the things that we're doing, Action for Health outlines a strategic plan, a plan for healthcare that will take time, and it's going to be incremental investments. So, when people say, about the Native Family Practice Register, we talk about attachment and we talk about access and the difference between those two things. Then we look at our colleagues in labor skills and immigration, and we know that we've exceeded already last year's, immigration of people that have moved to Nova Scotia. We also know that virtual care Nova Scotia is really a great option for some people, not everybody. So there's a number of things that have contributed to that list. Our hope is that it's going to slow soon, but we also want to make sure that people on that list understand that they have access to primary care through Virtual Care Nova Scotia, through primary care clinics working collaboratively with Virtual Care Nova Scotia in order to get the care that they need. It is going to take some time. Recruitment, retention, I would say, is our main focus, because we need those care providers here, but also understanding what are the innovative ways that we can support Nova Scotians, like a pharmacist and a nurse practitioner working together in several communities around the province to provide primary access, as an example. So we're looking at innovation where it works. We're looking as well at optimizing practices, as an example. We have an optimization team that can go in and support folks in understanding how their practice is working and if there's capacity for them to take on more people. And we've had really good success at the Dal Family Medicine practice, as an example. That's kind of been the flagship for that program. So when people have an opportunity to talk to us, they know that we're working on things. They understand that there are initiatives underway, and we can see early successes in a number of these areas, and we know that those will scale.
Minister Thompson, I thank you for your time. Is there anything else you wanted to say that I didn't ask you about?
There's two things that I would like to add, if I could. Number one, as we enter this holiday season, we're able to gather in a different way than perhaps we have in the last couple of years. I can't underscore enough the importance for all Nova Scotians to be vaccinated, not only for influenza, but if you are due for a COVID-19 booster, really essential that you get those vaccines. While they may not fully prevent illness, they really do prevent severity of illness, and it's an important way for us to protect our loved ones, and really considering not just our own risk, but the risk of the people that we're celebrating the holiday season with, and planning accordingly using the tools that we have. And the other thing that I would ask is that, early on in COVID-19, our healthcare workers were deemed heroes, and we were banging pots, and we were, really celebrating and encouraging them. And I would say that right now our healthcare workers need that as well. We're not we're in a time of high demand. The staffing levels are difficult, and I ask that folks who go to seek care be kind and patient to each other and to our healthcare workers. We need to continue that support. I know things are strained, and I want to assure people that we're working hard, and I ask for that generosity towards our healthcare workers because they really are working very hard on our behalf, and I want to acknowledge all of them for that. So thank you.
She is the Honourable Michelle Thompson, Minister of Health and Wellness, Minister responsible for the Office of Healthcare Professional Recruitment, and she joined us from her constituency office in Antigonish. Thank you so much.
Thank you.